This is Doc Chris Fisher, and I was just going to follow up with a few of the questions. I know I've been getting a bunch of questions about chiropractic. Tell me a little bit more. So what I'm going to do is to go down a few of those questions and just answer those here in this YouTube video for you. The first question really is what is chiropractic? And chiropractic is a health science that deals with the bones and the joints. And so if a joint is out of place, then it's going to pinch on a nerve, especially like in the spine. And if it's pinching on a nerve, then basically that causes pain to be manifest there in the body. So if we reduce or get rid of that pinching of the nerve, then that should help with some of the pain. Another question that I got is what to expect on the first visit. And I'm going to kind of run you through a few of the things that we would do on our first visit. When you come in, what we'll do is we'll give you some paperwork that's going to be a health history intake. That intake form is going to have information on it like surgeries and hospitalizations, things like that. Then I'm going to sit down and do a consultation with you. I'm going to ask you specifically what it is that's bothering you, and then like how long you've had this, what kind of pain you're having. After we go through the consultation of finding out exactly what it is and identifying the problem that you're having, we'll go through an examination. I'll do some orthopedic tests, we'll do some muscle testing, but I'm really looking for, is there a subluxation? Subluxation is a fancy term that chiropractors use that says that there's a bone out of place, and specifically the spine. So if we find some subluxations or bones that are out of place, then what we'll do is we will do a chiropractic adjustment to be able to help restore the normal joint function there in the spine. Now we can also adjust elbows and wrists and shoulders. A lot of times I get patients that come in that have like the frozen shoulder, and we can do some adjustments for that as well. Chiropractic works wonderful for back, neck, and spine pain, but also works wonderful for wrist, elbows, shoulders, knees, and ankles.
Yeah, last month I went to the hospital because of my problem, my back. I can't even walk. That's my and my ortho diagnosed it as I have a problem in my spine. So he even recommended me to undergo surgery. But at my age like this, I don't want to undergo any surgery, because I think that's enough for me. So my son recommended Doc Chris about the problem. So this is my third time.
Yeah.
This is my third time, and I feel much better than before.
Okay.
I don't need to go to undergo surgery. I feel better.
Okay. One of the things that chiropractic can assist with is with scoliosis. And I see a lot of scoliosis in the office. Scoliosis really just means that there's that curve in the spine. It could be that there's just a slight little bit of a curve there, or it could mean that there is a real big curve there on the spine, both of which would be called scoliosis. Now what chiropractic does is, again, we come back, we find the joints that are not functioning properly, and we work on adjusting those joints. Many times that'll start relaxing the muscles, and as it relaxes the muscles, then what it's going to do is it's going to decrease pain because the nerve is not being pinched, and then it helps to straighten that spine up a little bit. And so over time, chiropractic can help with scoliosis, maybe get a little bit less of the curve, or sometimes really just help it all together to be leveled out and nice and even. Just depends on how severe the scoliosis is. How do you know if you need chiropractic care? Now basically, if you're having pain, headaches, neck pain, shoulder pain, chiropractic many times has helped with a lot of these different types of pains. So if you have some of those types of symptoms, then give me a call and we'll get you scheduled and we'll check that out and we'll see if there's something that chiropractic can do. Are chiropractors real doctors? And that's a question they get asked a lot. So a medical doctor goes to school to learn medicine. They become a medical doctor. An MD is after their name. Chiropractors go to school and learn much of the same things that medical doctors do. And in some instances we get more education on things like anatomy and physiology. But we get what's called a Doctor of Chiropractic degree. So the letters after our name is DC, or Doctor of Chiropractic. So yes, my diploma says Dr. Chris Fisher. I am a Doctor of Chiropractic. So just a few success stories that I wanted to just share. I've had many numbers of cases that I've been able to help, but a few that come to mind is one person that was coming in with some severe headaches, was having like migraines at least once or twice a week, missing a lot of work, and we were able to do a good complete history on her and start adjusting her. And within just a few weeks we were able to get those migraine headaches down from 2 or 3 times a week, where she was actually missing work, to maybe once or twice every few months. And so it works wonderful for the migraines and the headaches. Another case where I had a gentleman that he couldn't even raise his arm because of a pinched nerve in the neck, and so his arm literally was just like it was dead. He had to raise it up to be able to set it down on the table or to even move it. And after doing chiropractic with him, identifying the pinching that was in his spine, we have been able to now restore it to where he can start using that arm, getting that nerve flow from the brain. You used to come here to the UN Chiropractic. It's been about almost a year since you've been adjusted.
Yes.
And then tell me what you came in this time with when I first saw you.
Well, I was in a bus crash 2 years ago, and that's how I started. And so I haven't seen a chiro for a while, and I think I've always had a little bit of pain in my neck. So I came to get that taken care of.
Okay, so you were hurting a little bit when you came in, and we've seen you now 3 visits.
3 times.
And how are you feeling now?
Pretty good. The motion in my neck is much better, and the pain is just about gone, so I'm happy.
So the next step would be to go ahead and give us a call and get an appointment scheduled. You can look up one of these phone numbers right down here and give us a call, or on Facebook you could message us, look us up by United Nations Chiropractic, Quezon City, and send us a message there. So either way we can get you a time set up, and let's check that out for you and see what we can do. Thank you for being here today, and don't forget to hit that subscribe button and like and share that, and then you'll be able to get all of the new updates that we record. Watch for future videos where we're going to be adjusting patients, as well as some tips on how to live your life a little bit better. So give us a thumbs up, like, and subscribe for us. Thank you.